So now we'll talk about essentially mouth care for patients that are ventilated. So this is extremely important for our ventilated, our intubated and ventilated patients because as you can see, the tube being in their mouth, they often have their mouth open. Actually, their mucosa gets very, very dry. They accumulate secretions, and these secretions could drop down lower down into their trachea, right above that cuff that we talked about for endotracheal tubes and tracheostomy tubes. And then we can get some micro aspiration where these secretions drop into the lungs. So what we want to be doing is actually cleaning their mouth and suctioning out all of those secretions that may accumulate. So we tend to do this every 4 hours with our critically ill patients that are intubated and ventilated. Oftentimes, some hospitals might have packages that kind of come pre-prepared for the Mouthcare kits. So you often have a toothbrush that actually has a hole here because this is to suction. So we actually connect that toothbrush to our suction, and once we block the hole, it actually suctions out. So as we brush our patient's teeth, we actually suction out anything that's coming off, or any saliva or secretions that are there. So it often comes with a toothbrush, and then also it'll come with a green sponge that's there that we use to apply some moisturizing cream to the mucosa inside the mouth and lips. To ensure that we keep the mouth well moisturized, because if it cracks and breaks, that's when the bacteria can just essentially move into those spaces and contaminate the area. So they often come in a pack also with the so that little package of moisturizer. So we'll pretend that this one is a little package of moisturizer for the mouth, and it has a mint flavor somewhat. So it will also come with a package of chlorhexidine gluconate solution. It's a diluted solution, similar to our alcohol swabs, but not an alcohol swab. It's a liquid solution that we actually use as essentially our toothpaste for our patients. So that's what's going to, it's antiseptic, so that's what's going to help remove all the bacteria and plaque on our patients' teeth and gums. So that package might come all together, or it might be in separate packages, individual, that you have to gather to be able to do your mouth care. So for this presentation, I'm going to pretend that this container here is full of our chlorhexidine gluconate solution. This is our moisturizer, and then we have our toothbrush and our sponge. So when we're doing mouth care for our patients every 4 hours, it's quite simple to, hand hygiene, protective equipment as required. Explain to our patient what we're going to do. Some of them really don't like mouth care, others just love it because it just feels nice and fresh. So it really depends on our patient. So sometimes they will try to actually close their mouth and bite down on the toothbrush. So just to be very careful of any fingers as you're doing mouth care. So once we've connected here our toothbrush to our suction, we can go and dump it, put some chlorhexidine on that, and just go in and brush our patient's teeth. So as you would for yourself, you go on both sides. There is a chance that you'd have to kind of try to move a little bit the endotracheal tube to try and get to corners higher up. But you want to be brushing like we would all our other patients. Chances are you'll go do that a couple of times. You also want to be able to brush their tongue and their gums. And sometimes they have some secretions stuck at the top of their palate that you might want to go and try to remove. So you go back and forth, cleaning your toothbrush and going back in their mouth to clean as required. Once you've done a thorough cleaning, then that's when you can come and take, after disposing of this in the garbage, you can come and take your sponge. Some of the sponges that you might actually find have the same suction ability, actually. So if you wanted to just rinse, just rinse off some areas, or try to remove a little piece of dried secretion or anything like that, you can actually do it with this, and having that suction does help. Sometimes, often, if our patients don't have any teeth, instead of using a toothbrush, we would actually use a sponge to clean their mouth. So otherwise, you would get just a stick like this, and you could open your moisturizer, put your moisturizer on your, so if I pretend here, put your moisturizer on your swab. And then once you have it on your swab, you would go in the mouth and just put the moisturizer kind of inside their cheeks, on their gums, on their tongue to moisturize. And then you can go ahead and put some more and apply to their lips to keep their lips nice and moist so that they don't crack and break. One thing to really pay attention when you're doing mouth care for our patients is actually the endotracheal tube. Sometimes the tube is really pressing down on a lip or on a corner of a lip or really down on the tongue or even in the back of the throat, and that actually creates pressure injuries. So you might actually see kind of a purple scab on their lip. It's potentially because the tube is pressing on it and it is creating a pressure injury. And so that would be something that you would tell your respiratory therapist so that they consider moving the tube maybe to the other side of the mouth or another area so that we can relieve the pressure off of that area. So very important to really inspect the mouth while you're doing your mouth care and ensure that the endotracheal tube is not causing any discomfort. There are patients as well that might choose to bite down a lot on their endotracheal tube, and you might find a bite block. So right near where their teeth would be and where their lips would be, you'll see oftentimes it's orange and this big kind of plastic hard kind of tube that covers the endotracheal tube. So that's a bite block, and you also want to make sure that that's not causing any type of pressure injury for our patients because it does take quite a lot of space in the mouth. So you want to make sure that that's not causing any damage. And inspect the teeth because they might have bitten down so hard that you might have some broken teeth, which could also occur after insertion of an endotracheal tube. There may be some broken teeth, hopefully not. Rare that it happens, but it may happen. So you might want to look at that if you have a patient that's just been intubated recently. The next step after doing that mouth care is actually to get a suction catheter, as we would with, when we go suction either nasopharyngeally or through a trachea. You will want to get that catheter to go down and, connect it to your suction, go all the way down so that you can suction all the collection of secretions that might be above the cuff of your tracheostomy or your endotracheal tube. Once you've done that, then that would be you being finished your mouth care for your patient, and you'd have to repeat in 4 hours.